Hi, this is Vonda. I'm with KVP International.
And my name's Tess.
And we're here today to show you the Balto joint. The joint is a really excellent brace for those patients that have arthritis or arthrodesis in the carpal joint or their wrist joint. For this one, you can use it with the aluminum splints or you can remove them. And then when you wrap this around your dog's leg, you have a true compression brace. So it's going to help relieve inflammation and increase blood flow for that joint.
So how do I know what size to order for my dog?
So with this particular brace, you want to measure the circumference of the carpal joint or the wrist of your dog, and that's going to help drop you into a category for correct fitting. If you're between sizes, let's say between a small and a medium, go one size down so that we get proper compression for the support your patient needs.
So can your pet wear these braces simultaneously on both legs?
Yes, if you have bilateral need, especially if we have carpal arthritis in that joint, you can use this compression band on both sides at the same time.
So what would you advise if I ordered a size that's too small or maybe say a little too large?
So as soon as you get the brace, if it looks like it's too small or too big, you want to get a hold of us as soon as possible, and somebody on the KVP Ortho team will help you switch out for the correct sizing.
So what age would this brace be recommended for use?
So depending on need, you definitely want to work with your veterinarian, especially with a growing patient, to make sure that we don't impede those growth plates at all. So continue to have those conversations with them and they'll help you with the best support.
And how long does it typically take for your dog to adjust to a brace like this?
So we want to start with, say, 30-minute increments. So the first day, a 30-minute wear, then up to an hour, 2 hours. Take 1 to 2 weeks to fully transition them into wearing the brace. Ultimately, we want 12 hours on, 12 hours off, giving the skin and coat time to breathe.
So is this brace able to get wet or is it waterproof?
So it's not waterproof, but it can get wet and then you can hang to dry. If you need to take them out to the restroom and it's raining or muddy outside, just cover the leg and the brace with a bootie, a sock, or a plastic baggie to protect it. When you need to wash it, for this one, remove the aluminum splints and you can hand wash in cold and then hang to dry. You can also machine wash this one, but make sure you close the Velcro back down. So one of my bonus tips with the Balto joint is that this one is also a particular compression band that you can use to help cover a lick granuloma. So when we have a lick granuloma on a patient, it tends to be on a joint. Sometimes it's associated with arthritis, sometimes it's not, but this particular band will help cover that up so that the lick granuloma itself will heal faster. Also, this is another one that you can use to help cover an IV catheter if you have a patient that doesn't necessarily want to leave it alone in the hospital. So use one of our e-collars and this band to protect that catheter.